Welcome to Weekly Neurology Deep Dive. Just a quick reminder, this deep dive is strictly for educational purposes. No commercial interests here. We'll try to give you a good overview, a manageable overview of some complex neurology topics. But definitely always remember to go back to the full source material for the complete picture. This week, we're diving into a really fascinating review article. It's from Neurotherapeutics, and it's all about using AI to really make EEG even more powerful in neurocritical care.
Yeah, I think you're right. It is a fascinating area, and it is evolving so rapidly. It really has the potential to significantly impact how we manage, our sickest patients, and especially in neurocritical care, where time is really, really of the essence.
As neurologists, I mean, we already know how valuable continuous EEG is, but it can also be incredibly time-consuming to analyze all that data. And this paper really explores how artificial intelligence is changing the game, helping us to make faster, more informed decisions, for these patients where minutes matter.
Absolutely, and the review article really highlighted this with some data. They actually pointed to a study showing a 364% increase in the use of CEEG for patients with acute cerebrovascular diseases, and that was just between 2014 and 2020.
Wow, that's a dramatic increase.
It is, and it really highlights, just the growing recognition of CEG's importance, but it also, at the same time, kind of underscores the need for tools that can streamline and accelerate that analysis
Yeah.
because it is so time consuming.
That's right. So let's dive into some specific examples here, starting with seizure prediction and management. The paper highlights this thing called the 2HE-LPS2B score, and it's really being presented as a simple yet surprisingly powerful tool for predicting seizure risk in hospitalized patients. Could you maybe elaborate a little bit on what that is and how it works?
Sure. So the 2HEL at PS2B score, it uses early EEG features, and it uses those features to assess the likelihood of a seizure and guide the duration of how long we should be monitoring with the CEG. And so it considers factors like, the presence of certain EEG patterns, such as lateralized periodic discharges, LPDs, or sporadic epileptiform discharges, SEDs, the frequency of these patterns, and any prior history of seizures that the patient may have. And it kind of takes all that information and then generates a score. And that score corresponds to a specific probability of having a seizure.
So how does this score actually translate into clinical decision making? What do we do with this score once we get it?
So, for example, a patient with a score of 0, that has a predicted probability of seizure of only about 5%. So that suggests that further CEG monitoring might not be necessary. On the other hand, if you have a patient who has a score of 3, that raises the probability to 50%. And that indicates a need for at least 24 hours of monitoring. And then on the more extreme end, if you have scores of 6 or higher, that indicates a very high risk, exceeding 95% probability. And in those cases, prolonged monitoring is strongly advised.
Right. So it really provides like a nuanced assessment that can directly inform our decisions, and it helps us, allocate our resources efficiently and just make sure we're monitoring the right patients for the right amount of time.
Exactly.
Exactly.
Are there any other tools besides this scoring system that can also aid in seizure management? Yeah, so the paper also highlights quantitative EEG tools, or key EEG, and their role in rapid seizure screening. So, for example, compressed spectral arrays, CSAs, they offer a really nice visual representation of the EEG data, and they make it easier to kind of spot seizures, because seizures often, manifest as a really distinct pattern on these CSAs. So it facilitates identification. And studies have shown that using CSAs can significantly reduce the amount of time that's needed to actually review EEG. For example, one study found that it decreased the average review time for 24 hours of CEGE data from 38 minutes to just 8 minutes.
Wow, that's a significant time savings that could be really beneficial in busy clinical settings like we often find ourselves in, where time is just so critical. And I imagine this also has implications for who can contribute to the analysis, to the EEG analysis.
You're absolutely right. So key EEG tools like these CSAs, they're kind of creating opportunities to involve, non-neurophysiologists in the EEG screening process. And research is already showing that with the proper training, nurses and other healthcare professionals, they can utilize these tools to identify seizures with a good degree of accuracy. And this is really exciting because it could potentially help address the shortage of neurophysiologists that we're seeing, especially in areas with limited access to these specialists.
It's almost like democratizing access to these powerful diagnostic tools in a way. But of course, it's crucial to remember that these are tools that are meant to assist and not to replace the expertise of neurophysiologists.
Absolutely. The gold standard still remains a thorough review of the raw EEG data by a qualified
For
neurophysiologist.
sure. The article also talks about, AI's potential to personalize anti-seizure medication management, which I think is a really interesting concept. Can you tell us a little bit more about that?
Yeah. So right now, we relied heavily on these population-level guidelines to guide treatment decisions. But AI has the potential to analyze individual patient data, including factors like their age, their genetics, comorbidities, even how they've responded to previous medications, to really tailor treatment strategies that are more likely to be effective and minimize those side effects. So it's really taking it to the individual level.
Yeah, it's like a shift from this one-size-fits-all approach to a more personalized, precision medicine model for seizure management.
Precisely. And some research is even exploring how AI can be used to optimize anesthetic dosing, particularly in situations where we're aiming for burst suppression, such as in refractory status epilepticus, where you
Yeah.
really have to strike that right balance.
Right, where it can be very challenging to find that sweet spot. So that AI could actually help us navigate that delicate balance
Yeah.
by analyzing the EEG data in real time and giving us guidance on dosing adjustments. And ultimately that, enhances patient safety and improves outcomes.
Yeah, and the potential impact of AI in this area, I think, is pretty significant. And the paper doesn't limit itself to seizure management. It also delves into how AI is being used to predict patient outcomes in various conditions, like disorders of consciousness and traumatic brain injury. And this is where AI, I think, is showing real promise in helping us to understand, which patients are more likely to recover and to tailor our treatment plans accordingly. Let's start with disorders of consciousness. These patients present unique challenges because it's often so difficult to assess their level of awareness and predict their potential for recovery. And traditional clinical assessments, they may not always capture the full picture of what's happening in the brain.
It can be really frustrating to feel like we're kind of working in the dark a little bit when it comes to these patients. Are there any tools that we can use to kind of shed light on their cognitive function, beyond just the basic clinical exam?
Yeah, and that's where EEG, especially with the help of AI, can be incredibly valuable in identifying, signs of consciousness that we might otherwise miss. And the concept of cognitive motor dissociation, or CMD, is really key here. So CMD, it refers to situations where a patient demonstrates, signs of cognitive function,
Yeah.
like brain activation in response to commands. But despite that, they're unable to physically respond or communicate.
So you could have a patient who appears completely unresponsive, but their brain is actually processing information and reacting to stimuli. That's incredible. So how does it factor into all of this?
Well, the AI can act as a decoder, helping us to interpret those subtle signs of brain activity. And the article highlighted a study where researchers used machine learning to analyze EEG data from patients in a vegetative or minimally conscious state. And while these patients appeared unresponsive, the AI was able to detect brain activation in response to commands, indicating that there was some level of preserved cognitive function there.
So suggesting that there's more going on, beneath the surface than we might realize just from looking at the patient. Did they find any connection between these findings and the patient's ultimate outcomes?
They did. So the study found that approximately 15% of these seemingly unresponsive patients displayed this brain activation on EEG in response to commands. And remarkably, those who showed these signs of brain activity were significantly more likely to show, clinical improvement, even regaining the ability to follow commands compared to those who didn't.
That's pretty amazing.
Hmm.
So knowing that there's still some level of cognitive function present, I mean, that could really, really significantly influence our management decisions.
Absolutely, yeah.
Yeah.
It might impact decisions about, continuing life-sustaining therapies or pursuing more aggressive rehabilitation strategies. It really underscores the importance of not underestimating the potential for recovery, even in patients who appear to be completely unresponsive.
Yeah, it's like the AI is giving us this
Yeah.
powerful tool to really understand these patients better and to advocate for their care in a way that we couldn't before. The article also mentions the use of AI in traumatic brain injury or TBI. What sort of insights does AI offer in this area?
Well, TBI, it can have such a wide range of long-term consequences, and predicting those outcomes, especially in those early stages after the injury, is very challenging. And AI is proving to be a really valuable tool for analyzing these vast amounts of data that we're getting from EEG, identifying subtle patterns and correlations that we might miss with just manual analysis.
So it can almost help us to anticipate potential complications and
Yeah.
to intervene proactively.
Yeah.
Do you have any specific examples of that?
Sure. So for example, the article mentions that AI can utilize, EEG features to identify patients at higher risk of developing post-traumatic epilepsy, and this early identification allows us to intervene, with anti-seizure medications to try to reduce the risk of seizures and hopefully improve long-term outcomes. And AI can also be used to predict overall recovery and functional outcomes after TBI.
That's really crucial information for patients and,
Yeah.
and their families, to kind of give them a clearer understanding of what to expect and allow them to plan accordingly. I mean, that's really powerful.
Yeah. And the article highlighted a study where a machine learning model using 16 different EEG features was able to predict recovery with greater accuracy than models that relied solely on, clinical, radiological, and laboratory data. And this is particularly significant in moderate to severe TBI, where the spectrum of potential outcomes is so vast.
Yeah, so it's like we're moving beyond these broad prognostic categories to something that's much more personalized and accurate for the individual.
Right. And the paper also discussed the use of AI and EEG in the context of anoxic brain injury after cardiac arrest, another very challenging area for prognostication.
Yeah, I mean, we often rely on, clinical guidelines and risk scores to try to predict outcomes in these cases, but they're not always reliable. So
Yeah.
how is AI changing our approach to these patients?
Well, continuous EEG has emerged as a really valuable tool for assessing brain activity and kind of gauging the potential for recovery after cardiac arrest. And AI is stepping in to analyze these vast amounts of data that we're getting from continuous EEG, looking for trends and changes that correlate with outcomes.
So it's like it's sifting through all that data to find these subtle indicators that we might miss with just manual analysis. What kind of accuracy are we seeing with these AI models? I mean, is it actually better than what we can do as clinicians?
Well, the article indicated that some AI algorithms are actually surpassing the accuracy of trained experts in predicting neurological recovery after cardiac arrest. And these algorithms, they analyze various EEG features, including, band power, Shannon entropy, and burst suppression ratio.
Wow, that's pretty amazing. Um, are these AI models limited to just analyzing the EEG data alone, or can they incorporate information from other sources as well?
Yeah, some of these models can also incorporate data from other sources like clinical variables and imaging findings, and this kind of further improves their predictive power. So it's a more multidimensional approach to prognostication.
Right. It's taking everything into account to give us a more comprehensive and accurate assessment. It's really remarkable how AI is transforming our ability to understand and to predict outcomes in these really critical situations.
Yeah, absolutely. And another fascinating application that the article highlighted is the use of AI to detect and manage delayed cerebral ischemia or DCI in patients with subarachnoid hemorrhage.
Right, DCI is a really serious complication. It can significantly impact patient outcomes, and predicting who will develop DCI and when it will occur has always been a real challenge. So how is AI actually helping us to kind of address this challenge?
Well, researchers have used machine learning to analyze EEG data from patients with subarachnoid hemorrhage, and they've found that certain EEG features can actually predict DCI. These features include, the alpha delta ratio, percent alpha variability, Shannon entropy, and the presence of epileptiform discharges.
So it's like the AI is learning to recognize these subtle warning signs in the EEG that might indicate an increased risk of DCI.
Yeah.
And is this detection happening before or after the clinical symptoms appear?
That's a good question. And what's really impressive is that some of these AI models can actually predict DCI before the clinical symptoms manifest. So it's like an early warning system. It gives us this really crucial window of opportunity to intervene and potentially improve outcomes.
Right. So early intervention could involve things like blood pressure management or
Yeah.
medications to prevent vasospasm. It's another example of how AI is enabling us to be more proactive in managing these complex cases and preventing potentially, devastating complications.
Exactly. And AI is also being used to optimize anesthetic dosing and sedation management. And this application is particularly relevant for neurologists, especially when we're dealing with patients who require prolonged sedation or those with refractory status epilepticus.
Right. Managing sedation levels is always such a delicate balancing act. Too much sedation can lead to complications, while too little can be ineffective or even dangerous. And in some cases, like you mentioned, refractory status epilepticus, we're intentionally aiming for burst suppression. But finding that right balance with anesthetic dosing can be so tricky. So is this where the AI comes in?
Precisely. So AI algorithms can analyze EEG data in real time to assess the level of burst suppression and provide guidance on anesthetic dosing adjustments. And this is particularly helpful in situations where we're aiming for a specific level of brain activity.
So it's almost like a more objective, data-driven approach to sedation management, which enhances patient safety and it also frees up, valuable clinician time to focus on other aspects of care.
That's exactly right. And some of these AI algorithms can even, adapt to changes in the patient's condition over time. So they're constantly learning and refining their recommendations.
It's really a dynamic and personalized approach to care. The potential for AI in neurocritical care really does seem vast.
Yeah.
What are your thoughts on kind of the future of AI in neurology as a whole? Beyond just the neurocritical care setting, where do you see this going?
Yeah, it's like we're uncovering this whole new language of the brain, and AI is the tool that's helping us to decipher it. It's really exciting to think about, the potential for new discoveries and a deeper understanding of brain function. I mean, it feels like we're just getting started.
I think you're right. We are witnessing a
Yeah.
real paradigm shift in neurology, but it is important to remember that we're still in those early stages of this AI revolution, and as we gather more data, refine algorithms, and conduct more clinical trials, we can expect even greater advances. In the years to come. It all sounds very promising and exciting, but I imagine there are challenges to overcome as well. The article kind of touched on some of those. What are some of the biggest hurdles that we need to be thinking about?
Right. So one that the article talked about is just the variability in access to prolonged EEG monitoring, computing resources and trained personnel. And this varies widely across different institutions. So addressing those disparities, I think, is crucial to ensure that all patients can benefit from these advancements.
That's right. It's not just about developing the technology. It's about making sure that it's actually accessible. It's about democratizing access to these powerful tools and ensuring that AI-powered EEG analysis is available not just in specialized centers or research settings, but in diverse clinical environments. Are there any other challenges that we need to be kind of mindful of as we move forward with this?
Yeah. Another challenge is the generalizability of these AI models. So
Yeah.
many models are trained on data from, very specific patient populations or even just single institutions. And it's important to make sure that these models are robust and
Yeah.
can be applied accurately to a wider range of patients, regardless of their background or the specific clinical setting that they're in.
That makes sense. So it's about rigorous testing and validation. In diverse patient populations, we need to be confident that these AI tools, are reliable and effective, no matter who the patient is or where they're receiving care.
Exactly. And ongoing research and validation, I think, are really critical to achieving this level of confidence. We have to rigorously evaluate these AI models in real world clinical practice to really make sure that they're safe and effective.
And education, I think, also plays a really crucial role here. Clinicians need to be equipped with the knowledge and the skills to actually use these tools effectively and responsibly. It's not just about having the technology. It's about knowing how to how to use it properly.
For sure. And I think it's important to emphasize that AI should always be augmenting, not
Right.
replacing, clinical judgment and expertise. It's a partnership. It's human intelligence and artificial intelligence working together to enhance patient care. So that really underscores the need for ongoing education and training for neurologists and other healthcare professionals.
So for neurologists who are, listening to this and thinking, okay, this is all very interesting, but how do I actually start integrating AI into my daily practice? What advice would you give them? What are some practical steps that they can take?
I think the first step is awareness. Stay informed about the latest developments in AI and EEG, understand, the potential benefits, but also the limitations of these technologies, and really think critically about how they might be incorporated into clinical practice. And then seek out opportunities for education and training. There are, courses and workshops, online resources available that are specifically designed to teach neurologists about AI and its applications in EEG analysis.
So it's really about embracing this lifelong learning mindset and recognizing that AI is not just a fleeting trend. It's really a transformative force in neurology.
Yeah, engage in conversations with colleagues, attend conferences, keep up with the latest research publications. It's a rapidly evolving field, so it's important to stay current.
This has been a really fascinating deep dive into the world of AI and EEG, and it's clear that these technologies are already making a significant impact on neurocritical care. And I think you're right. We've only just begun to scratch the surface of their potential.
I agree. As these technologies continue to evolve, we can expect even more exciting applications of AI in our field. It's a very exciting time to be a neurologist.
Absolutely. And as a final thought for our listeners, I encourage you to really consider how AI might be integrated into your own clinical practice. How can you leverage these tools to enhance your diagnostic accuracy, improve your treatment decisions, and ultimately deliver better outcomes for your patients? The future of neurology is here, and it is powered by AI.